I feel young inside, so I definitely didn't want to look old on the outside. And when I noticed the smile lines were getting deeper, especially after looking at a photograph, I realized then that, yeah, I don't want to feel old, so I'm not going to look it. The treatment only took about a half an hour, and I was in and out of there in a short period of time, and could have gone back to work, but I chose to go shopping. I would definitely tell my friends, do it. It doesn't hurt enough to keep you from doing it. I couldn't wait to show my husband. I hadn't told him I was doing it, and I was worried that he would walk in and say, "What did you do?" But he didn't. He walked in, he said, "Oh my goodness, you look wonderful." And I said, "I know, it was definitely worth it." I recently went back to my hometown and ran into some old friends from high school. And the first thing they did was, "Oh, moving to Arizona has really done well for you. You look so young. You look great." I have gone a few places recently without makeup, and that's something I vowed I would never even go to the mailbox without my makeup. And now I don't have to worry. Well, I felt like I looked good in jeans, no matter what I had on. Now I feel like that I can get those questions again, that someone will say, "Oh, you're too young to be a grandmother."
Important safety considerations of Restylane. Restylane restores volume and fullness to the skin to correct moderate to severe facial wrinkles and folds, such as the lines from your nose to the corners of your mouth, nasolabial folds. After your treatment, you might have some swelling, redness, pain, bruising, and tenderness. This will normally last less than 7 days, although rare, red or swollen small bumps may occur. If you have had facial cold sores before, an injection can cause another outbreak. In rare circumstances, the doctor may inject into a blood vessel, which can damage the skin. To avoid bruising and bleeding, you should not use Restylane if you have recently used drugs that thin your blood or prevent clotting. If you are pregnant, breastfeeding, or under 18, you should not use Restylane. Restylane should not be used by people with previous bad allergies, particularly to certain microorganisms known as gram-positive bacteria, or by people with previous bad allergies to drugs that have required in-hospital treatment. Restylane should not be injected anywhere except the skin or just under the skin. The use of Restylane at the site of skin sores, pimples, rashes, hives, cysts, or infection should be postponed until healing is complete. Use of Restylane in these instances could delay healing or make your skin problems worse.